Hi everyone, welcome to Nursing with CG. In this video, I'm going to talk about the easiest way of learning Glasgow coma scale. Glasgow coma scale is the scale which is used for checking the mental status of neurologically impaired patients. Patients with motor vehicle accidents, head injury, patients with stroke, patients with brain surgeries. We check the mental status and neuro status with this standardized tool. Glasgow coma scale is introduced in 1974 by Tisdale and Janet. And this has three major components: eye response, motor response, and verbal response. So every single component we assess with a minimum score and a maximum score. Minimum score is 1 and maximum score varies in each component. Eye response, the minimum score is 1, the maximum score is 4. Verbal response, the minimum score is 1, the maximum score is 5. For the motor response, the minimum score is 1, the maximum response is 6. So altogether, the minimum response 3 and the maximum response is 15. And based on this number, we categorize the severity of the case based on the value which we obtain through this assessment. So the Glasgow coma scale score 8 or less than 8 we consider as severe head injury. The Glasgow coma scale between 9 and 12 considered as moderate head injury. The Glasgow coma scale between 13 and 15 is considered as mild. So as the number goes down, the severity is more. The first component which we assess is eye response. The easiest way of memorizing this with the mnemonic ESPN. E stands for eye opening spontaneously, S stands for sound, P stands for pressure or pain, and N stands for none. When the patient opens the eyes spontaneously, patient scored as 4. Patient opens only with the verbal stimuli. You're calling the patient with the name, okay Thomas, open your eyes, open your eyes. That patient opens eyes with the verbal stimuli. In that case, patient will be scored as 3. And patient opens eyes with painful stimuli when you pinch the back of the ear or pinch at the forehead. Patient opens eyes with the painful stimuli, patient gets scored 2. If there is no response with any external stimuli, patient will get score 1. The next component we assess is verbal response, and which can be memorized with a mnemonic, our country win. How do you check the orientation? You ask the patient, where are you right now? What's your name? So if the patient gives you a correct answer, that patient scored as 5. When the patient gives you wrong answers for the questions which you asked, that is patient confused. In that case, the patient is scored as 4. When the patient doesn't make any sense to the words and the patient is talking in an inappropriate way, the patient does not make any sense to words, patient gets 3. And patient makes some inappropriate sounds like E, like ah, so those sounds, patient gets 2. And for no sounds or no response, patient will get the score 1. The last component is motor response. If the patient obeys commands, when you ask the patient to lift the arm, lift the leg, if the patient obeys, patient gets 6. When the patient localizes the pain, when you stimulate with an external pinch on the forehead, if the patient moves his hand and trying to take out your hand from his forehead, that means the patient is localizing the pain and the patient gets 5. When you do external rub, when the patient contracts normally, that is a normal flexion. In that case, patient will be scored as 4. Abnormal flexion, that is decorticate position, when you see the abnormal contracture. So in that case, patient will be scored as 3. Abnormal extension, that is known as decerebrate, the patient will be scored as 2. Then the last one, if there is no response, the patient will be scored as 1. That's all about Glasgow coma scale. Thank you so much for watching. Stay tuned for the next video and please don't forget to subscribe.